All right. So, yes, I was able to complete my practicum alongside Interior Health, working with the Healthy Schools team. And I was able to work remotely from Kelowna. And I recognize my presence on the traditional, ancestral, and unceded land of the Syilx and Okanagan people who have resided here since time immemorial. And I recognize, honor, and respect the Syilx Okanagan land upon which I live, work, and play. So, beginning in January, I had the privilege of beginning my placement alongside four amazing members of my team: Valerie, Brenda, Linda, and Rebecca. And so I'm just excited to share my insights and learning surrounding all that I learned about school health in the interior region. So, as I mentioned, I joined the Healthy Schools team in January to work to further school health initiatives. And I had the honor of being this team's first practicum student, which allowed both my team and I to learn from each other. And Interior Health covers nearly 59 municipalities, ranging from Kelowna to Williams Lake and almost everywhere in between. And Interior Health's mission statement is for population and public health teams to work to improve health outcomes across the population by promoting well-being and reducing health inequities. And the Healthy Schools team's vision is to support children and youth and families to achieve their best possible health outcomes. And so I was able to work on and complete multiple projects during my time with Interior Health alongside my supervisor and my team. Initially, I began reviewing the team's toolkit series. And so this series aims to provide educators and public health nurses with resources that align with the BC Ministry of Education's curriculum. And so my first project was revising the Equity, Diversity, and Inclusion Toolkit. And eventually, my team and I decided to split this into two separate toolkits, that being the original Equity, Diversity, and Inclusion and a new Gender Diversity and Inclusion Toolkit. So after completing this, I was able to give a presentation on these toolkits and my work to the health promoting school coordinators throughout the interior region. And then next, I was able to create health posters that were to be distributed throughout the interior health schools. So I created 4 posters on topics such as sexual health, travel vaccines, healthcare vaccines, and mental health. And so these posters imputed QR codes that students and staff could access to retrieve any additional information or help they needed. And they were also able to get in contact with their regional public health nurse throughout these posters. And then lastly, I practiced cultural safety and humility by reviewing the final report for Interior Health's Indigenous mental wellness grants distributed last fiscal year. And so these grants allowed each approved school to hold a day or a week or as much time as they could to do culturally important activities. And so after reviewing this final report, I condensed the information and created a shortened document, and as well as an infographic to present to Interior Health about what each school did with their grant funds and how that affected mental health outcomes for the students and the community. And so the various PHSP skills have all been guiding points throughout my practicum placement, but the first skill I developed was appropriately applying diverse perspectives on health and well-being from Indigenous, non-Western, and Western knowledge systems to public health issues. And so this skill really became prominent when creating the Gender Diversity Toolkit that I mentioned and the Equity, Diversity, and Inclusion Toolkit, as I had to sort of use this skill to ensure I was including very diverse perspectives from lots of populations, such as those with different sexual orientations, gender identities, ethnicities, and more. And I also developed the skill of examining community engagement and community leadership in population health and social justice. And this skill became prominent when participating in meetings with the health promoting school coordinators, as this community also plans to meet face-to-face at the end of this semester. So that has taken a lot of planning on behalf of our team, but I'm sure they're excited to get to meet finally. And another skill was developing and communicating health information effectively in interprofessional teams. And so throughout my experience, my team was among 4 to 5 people with interior health, and this skill became really essential to reach the populations we were looking to impact and audiences we were aiming for. So weekly, often we would meet with various teams within the organization to work interdependently with each other and get aspects from other teams in IH. So that was a really awesome experience to get connected with a lot of other teams as well. And lastly, I demonstrated cultural humility and critical self-reflection when analyzing public health information and interacting with diverse individuals, groups, and communities. And so cultural humility and safety have been really important in my work, especially when attending meetings with the First Nations Health Authority. And likewise, this has been important when reviewing mental wellness grant projects from the Indigenous schools across the interior. And so 3 values that became prominent during my time with Interior Health: diversity and cultural safety, have been as I mentioned, a really large guiding value as I made the toolkits that included those diverse populations. And as I worked alongside those grant reports with Indigenous schools, I often situated myself sort of within that larger picture of reconciliation, and caused me really often to reflect on that value and the ultimate goal at hand. And then interprofessional and multidisciplinary approaches to practice and research is something that I really relied on when I was struggling to build those toolkits and find those correct resources and research. So having these different teams within interior health and styles of collaboration brought a really fresh view to any issues I had. And so asking anybody from any teams, I was always sure to find an answer that came from somewhere else and was always right for the right audience. And then partnerships with people and populations served was the last value that I felt was most prominent for me. So forming those partnerships with a range of people from those Indigenous schools, a lot of other communities, health promoting school coordinators. And that was really essential as we met with a lot of representatives, such as, teachers, representatives, and then ensuring we had a partnership to relay information through and keep that line of communication open is always important to learn from each other. And then social and life course determinants have been an area that I've explored during my meetings alongside the Preventure team. And Preventure is a Canada-wide program that educates teens on mental health and substance use. So after sitting in on many meetings and being a part of discussions with the team, many social and life course determinants seem to play a big part in a lot of these students' lives. So students who are more likely to use substances often face socioeconomic challenges or challenges in other areas such as education, family life, income, housing, and so many more. And then improving health and reducing health inequities in communities is a key aspect of Interior Health's general mission statement and is a key knowledge area throughout my practical experience as well. And I found that these inequities really exist and disproportionately affect among that Indigenous population and how these schools had low resources. But luckily, Interior Health was able to fund some topics for their cultural important education for their, heritage and land. And then lastly, effective multidisciplinary teamwork is the last knowledge area. And communicating with various disciplines, such as, again, the substance use team, youth harm reduction team, and so many more teams alongside mine, it's really led me to practice teamwork throughout my practicum. And then I have chosen call to action number 62, which states we call upon the federal, provincial, and territorial governments in consultation and collaboration with survivors, Aboriginal peoples, and educators to make an age-appropriate curriculum on residential schools, treaties, and Aboriginal peoples' historical and contemporary contributions to Canada, a mandatory education requirement for kindergarten to grade 12 students. And so I chose this call to action as it really is resonating with my work with IH and that school health initiatives and connected to that. Especially after creating those toolkits for elementary education, it was evident that we could do a better job in educating that demographic specifically on the topics we listed in this call to action. And so after being able to see what schools are doing given funding alongside those mental wellness grants for those schools, it became that much more important that when we continue to do that and educate, that a lot can come from that. And then even changing the curriculum to include these resources and this information is really important to get the proper information out there. And then throughout my time with Interior Health, I gained insights on a lot of tools that I'm going to carry with me into my future work. And these range from interdisciplinary work and team communication and time management as well. And then those partnerships we talked about, and always going back to diversity and inclusion. And then generally throughout the BA program, I gained knowledge of any worldwide inequities, health promotion tactics, and specifically global health is my area of focus, and more in knowledge translation and evaluation, and coming back to Indigenous health again. So I now have a lot of insights from not only my practicum, but my program as well. So that's really exciting to head into a future career with knowledge behind me. And then in the next steps of my career, I wanted to develop my understanding of public health history in Canada and key events of our healthcare system. And to do this, I wanted to research the healthcare system and apply a lens of truth and reconciliation to understand the past and sort of go back to my call to action and research, sort of examine the past of Canada from a healthcare standpoint. And I hope to learn about these topics if I do go on to pursue further education. And then also I was looking into traveling to lower middle income countries and seeing firsthand what inequities exist. So it was awesome to see any internships that people had going on about traveling. So that was really inspiring and awesome to hear. And then researching countries that struggle with those basic needs and social determinants. So furthering those dreams and making those into a reality. And overall, my practicum with the Interior Health's Healthy Schools team provided really valuable experience in public health, and especially in things like equity and community engagement and cultural humility. And so moving forward, I'm committed to using what I've learned throughout that. And I just want to thank Valerie for helping me alongside and being an awesome supervisor, as well as Linda, Brendan, Rebecca. And then I just wanted to say congratulations to anybody graduating in June, and thank you all for your time today.